So today we're going to start a very important topic, which is basically the diseases that is related to the salivary glands. So let's start it. Bismillahirrahmanirrahim. Okay, so first of all, what are the we should know the most important is saliva. So the components of saliva is water. Okay, the water is present in saliva. Then we have enzymes are present. Okay, then we have actually antibodies are also present in them. Antibodies are present. Then we have mucin, which is also present in saliva. Okay, now functions of the saliva. Basically, functions of saliva is first of all is lubrication and cleansing. Due to this lubrication and cleansing, due to their lubrication function, there is basically in mastication there is ease. So basically the person can easily chew the food, and due to cleansing of teeth, there is no food impaction actually. Then buffering action. Due to their buffering action, there is a balance in the pH of the oral cavity. They balance the pH of the oral cavity. Antimicrobial properties are basically due to the enzymes basically that neutralize the bacteria and viruses, and the antibodies are also present in them, due to which they have antimicrobial activity. Pellicle formation is when the person brush after their 30 minutes. There is so fast the pellicle formation is this that helps the. Then there is digestion. For digestion, there is amylase, which basically initiate the starch digestion. Okay, there are different enzymes that digest the carbohydrate, proteins, and basically lipase and carbohydrate. Actually, protein is not digested in. We know that in saliva. Then facilitate the taste, of course. Then avoid dehydration and avoid in chewing and swallowing, which I have told you. Then salivary flow rate, very important, and can be asked you in your competitive exams, in your viva, that the normal flow is what is the normal flow per day, what is the normal unstimulated, stimulated, or okay. So the unstimulated flow rate is actually zero point 0.3 ml per minute. 0.3 ml per minute, and the most then unstimulated salivary flow rate during the sleep is 0.1 ml per minute. Okay, stimulated flow rate is actually 1 to 2 ml per minute. So basically unstimulated is means when you are not eating something, you're not basically, and there is a unstimulated. But stimulated is when you are thinking, so there is a stimulation of saliva. Now per day is 1000 to 1500 ml per day. Okay, very important. And the measurement is through the salivometry. If you want to measure the salivary flow, so salivometry is present, very important. Now moving towards the glands, major glands, you all know: parotid, submandibular, sublingual. In recent studies, basically there is an introduction of a new gland has been tobarial gland. Is being introduced in it. Okay, now the minor salivary glands are basically 600 to 1000 actually, and numerous, present on their tongue, palate, and buccal, labial mucosa basically. Okay, different time. Then the parotid gland, which is basically the most largest gland. This is wedge shaped, then located in front of the ear, behind the ramus of the mandible. It is actually behind the ramus of mandible. Okay, but if in front of the ear, Stenson duct is there. Basically, it is covered by a parotid papilla area adjacent to the which is basically adjacent to the second maxillary molar. Okay, the papilla. Okay, and the peripheral branches of facial nerves are associated with this. Okay, very important. And this is serous in secretion, very important. It can be asked in your MCQs that parotid gland secretions are what? It is serous. You should know it. Submandibular, 65%, the most. It basically secretes most of your saliva, so it accounts for 65% of your stimulated saliva. Okay, basically it is serous and mucus both. Watson duct is present here. It is actually a mixed duct. Ducts runs forward along the floor of the mouth and open into the sublingual papilla just lateral to the lingual frenum. It opens in your basically lateral to the lingual frenum. Okay, Now sublingual gland, which is 7 to 8% saliva it produces, and the secretions are mucus, numerous duct openings along their folds, and their duct name is Bartholin duct. Okay. Now their clinical examination. Now, how you basically clinically examine these glands. For parotid gland, always remember, stand behind the patient who is seated in a retroclined dental chair. You can see in this picture. Okay, so you should stand behind the patient who is actually seated in the retroclined dental chair, and then parotid saliva. Then compress the skin over the lying the duct with the fingers. Okay, you can see it. Then compress the skin, or that is, or lining the duct with your fingers. In some mandibular, by manual palpitation or by digital palpitation, we know it. This is the fingers in the floor of the mouth, and then dentally pressure exerted between or examine the hand and the finger. Okay. Then so it is basically by digital palpitation. Okay, with this.